Chapter 20, Periodontal Examination. We're going to be looking at just the first part of this chapter right now, and it's all about the mirror. So the mirror, probe, and explorer. This is called a setup pack. If your dentist says, can you get me a setup pack, or Dr. Thurlow does, or one of us, what we're meaning is to go into that closet, little closet into the clinic, and in one of the plastic tubs there are a lot of setup packs, and it just has a mouth mirror, a probe, and an explorer in it, so we don't have to get an entire set of instruments, of an entire cassette, unsterilized, if we're just wanting to get just look with a mirror, a probe, and an explorer. So they're called setup packs. So first, before anything else, any instrument touches the mouth at all, we are going to check to see if they need a pre-med first, of course, because any manipulation of the tissue with an explorer, a probe, whatever is could be an issue with if someone needs a pre-medication for like a heart valve or issue or something like that. So first we're going to check that. The key instruments, of course, like I said, are the mouth mirror, probe, and explorer, and that's it. The mouth mirror. There are parts of the mouth mirror. There's the handle, the shank, and the working end. And different types of mirror surfaces. You have flat, concave, convex. You have the diameter of the handles. They range from 5/8 of an inch to 1 1/4 inches. So they used to be really, really thin, and now they are more ergonomic, and the handles are a lot bigger and lighter. So the attachments, you can have a threaded where the mirror handle just screws on, and or you can have a cone socket to where it doesn't. It just is one piece. So the handles, like I said, you want them to be light, disposable. They have disposable mirrors. These are for screenings. If you go to a school, and hopefully this COVID will be over, and sometime in your program here, we usually send the students to different, or we take the students to different, could be a middle school, could be a primary or a high school, and we set up screenings, and we don't need an entire set of instruments. We'll just take set up instruments and try to use disposable mirrors. So we can use these disposable also for patient education or a really short exam. So here's pictures of different mirror surfaces. You have a front surface. This one is the most commonly used. It's no distortion. It's a really clear image. It's a reflecting surface on the front surface of the glass, and it can be easily scratched. So when we have these in your cassettes, we space them so that like your explorer or something like that isn't touching the mirror. You can also put a little piece, like a 2x2 piece of gauze in one of those setup packs so that your explorer or probe are scratching and touching the mirror surface if you'd like. So you have concave. This is a really magnified image, and that would be this one right here. So the reflecting surface is on the front surface of the mirror lens. It's not recommended because it does distort. So they do have a concave, but we're not crazy about that one. Then you have a plain flat surface, and this would be that one. The reflecting surface is on the back of the mirror lens, and it produces a double image, like a ghost image. It's not recommended because double image is distracting, very distracting. So we more like this front surface. So here is how you would use the mirror. And you're going to use this is called indirect vision, because we're sitting in front of this patient right here, and we're putting the mirror and we're looking right here, because we can't really see the back. So indirectly, we're looking at that. If we're looking direct, we're looking straight at a tooth, at the front of the tooth. If we're looking indirect, we're using a mirror to reflect the image. So it can give any one of these different types of uses. The purpose and uses, it's for indirect vision, which you've already seen, indirect illumination, transillumination, and retraction. So this is indirect vision, like we talked about. You're just putting the mirror in different places and you're looking at the mirror. And so you're viewing the teeth indirectly through a mirror. This is indirect illumination and indirect vision and retraction. They're using this mirror right here for retracting the cheek, pulling it back so that we can see, have a better view of the teeth. They're using this mirror and this for indirect vision, because we can see the back side, the lingual side, and we can see the distal of these teeth, the back sides of these teeth, because when you're viewing it from front, you can't see around that curve to that distal side here or here. So indirect vision is that, and indirect illumination. This is when you're using the light above you and the mirror the light hits the mirror and indirectly is illuminating the tooth. So we use that a lot, like a flashlight. This would be transillumination. Trans means through or across, and illumination means lighting. So this little light right here is up against the tooth, and this is what it would look like, just normal vision to us. And when we put this light up right next to the tooth, it illuminates, and the light goes across like this. And this is what we can see possibly right here. So that may be a little bit of decay down there, but we can see across and alert the dentist to looking at what it is. So here's some more transillumination. This light is shining right at the mandibular incisors, and you put the light in front and put it, angle it a little bit, and in back, you can see this, where when you're looking here, you see nothing, just directly. But you put that light up there and look indirectly with the mirror, and you can sometimes see a little bit of decay. So there's a certain grasp that we have, which is called the modified pin grasp. We are going to use this grasp with most all of our instruments. What it means is the way that you would naturally hold a pin, we've just modified that a little bit. So it's a modified pin grasp. So we can use it for retraction, retracting the cheek, the tongues, or the tongue. We try not to hit the teeth when we go into the mouth, and we can maintain clear vision. You rub the buccal mucosa to coat the mirror with saliva, or you can submerge the mirror in mouthwash, and it can help the mirror not to unfog. If you can get the patient to breathe through their nose instead of their mouth, that helps the mirror not get foggy. So care of the mirrors, make sure the debris is removed and discard if it's all scratched up. You guys in your packet should have a couple boxes of mirror heads. And so if your mirror gets to a point where it's difficult to see, throw it out and get a new mirror. You have plenty of them. So this would be a modified pin grasp right here. We use the almost like a pin, except these two fingers right here are placed like this around the instrument, and the instrument is against your middle finger. So this is another grasp on the right side and another picture of the different surfaces.